This is our presentation on the Sweden health system. Sweden has a population of about 10 million people. Their life expectancy is about 82 years old, 81 for men and 84 for women. They have a popular ethnic group of Swedish white, or they have a heavy immigrant population as well. Their GDP is about $55,000 USD per person, which is relatively high for how small their population is. Their healthcare system historically started back in 1752 with the first national hospital, Serafimer Hospital. They've had several reforms over the years, but this really took place in 1970 with the Seven Crowns Reform, which was a publicized reform that allowed healthcare to be only 7 crowns per visit. This was about $1 back in 1970, and it has continued to reform up until 1992, which is one of the more recent reforms with the HLTH reform. This is a reform that allows people to go to the hospital for free, basically for anything if they are 65 years or older, or if they have a handicap or they need psychiatric help. The societal background is very community-based. Their country is also very organized with their time and with their resources of funds. Their federal levels have organized healthcare down to a community-based level, which means that taxes are decentralized for local healthcare. This quote from the Swedish healthcare page says, "The Swedish health system is based on fundamental principles of equity, need, and solidarity, and cost effectiveness." That's really their goal for health.
I'll be talking about their health system performance compared to other countries. Sweden is much more effective in their healthcare. Up on the top left or top right, I have the minimal mortality per 1,000 people or 100,000, and this is compared to the EU. Their healthcare system performance is measured by their effectiveness, their accessibility, and their resilience. Here on this graph, we have the avoidable hospitalizations for chronic conditions. As we can see, Sweden is much lower than the benchmark for other European countries. Sweden is among one of the highest spenders on their health. As we can see here highlighted is Sweden and the EU. And then here again, we have the minimal mortality rates. This is broken down by men and women. This reflects the effective healthcare delivery in Sweden. And then to measure the assessment towards universal healthcare coverage, which is defined as the entire population having access to quality healthcare services without the risk of exposure to financial hardship. As we can see with highlighted Sweden here, there's a low report of unmet net needs for medical care. This is also shown without much disparity between income classes by the dots being closely clustered.
So for the health system building blocks of governance, we have at the national level agencies that provide regulations, 21 regional councils that provide quality health and medical care and promote good health in their jurisdiction, and then 290 municipalities that focus on giving care to the elderly and disabled and promoting healthcare in schools. Most of the financing is coming from regional and local governments. A little bit comes from federal, and some comes from patient fees, such as paying part of the drug costs. 13.5% is financed by regional councils to pay private providers, but the rest is from public providers. And then they are funded by capitation, fee for service, and performance-related bonuses. Dental care, preventive services, and healthcare for children and the elderly are covered. They also have quality assurance measures such as the National Patient Survey and other reporting. They have fixed rates for doctors and hospital visits. And then they have a patient wait time measure that includes waiting 90 days to see a specialist.
I will be talking about control knobs. The first control knob is on judging financing mechanisms. So because every citizen pays income taxes into the healthcare system, there's a form of individual mandate that substantially broadens the risk pool. So the general taxation is characteristic of a general revenue financing plan. Sweden also has one of the most equitable systems in the developed world because it does redistribute resources based on need. There is a strict fee schedule determined by each region that does not allow doctors to bill above the set amounts. And one exception to controlled prices would be any elective care that is not regulated. Because each person pays into the system with taxes, most healthcare is essentially free. Although some prescriptions and copayments are out of pocket, there is a low out-of-pocket limit for everyone.
Okay, and I'll be making some recommendations for the major weaknesses of the Swedish healthcare system. I list the major weakness here, the excessive wait times, which is mostly caused by the temporary practitioners that are in Sweden. Some recommendations to fix these. So Sweden has made some effort to fix this issue. They implemented, like we discussed earlier, the 030-90-90 law. Unfortunately, this doesn't always happen, and 1 in 3 people still wait longer. They also added the element of private insurance, but I still recommend that they provide better training for medical professionals and better incentives for people to stay and work in Sweden. Their need for medical staff from other countries and lack of doctors coming from their own country is majorly contributing to this problem. And I also recommended for Sweden to work on allocating more responsibilities and guidelines to local power, because this has proven to lower wait times in cities like Stockholm. As far as what the US can learn from the Swedish healthcare system, considering they have an average life expectancy of 82, it's obvious the US has a lot to learn from Sweden. My first recommendation to the US is to adapt to the universal coverage system, but include the private insurance elements that Sweden has. I also feel we can lower our costs similar to a rate that Sweden has, as well as learn from Sweden and their ability to adapt to their changing population and implementing new laws to help adapt to their changing demographics.
I just need to get this to stop.